Good afternoon to our partners from the Department of Health, respectable medical societies, healthcare practitioners, media, and fellow Filipinos. Thank you for joining and for spending your Thursday afternoon with us. I am Lara Ladines, Medical Scientific Liaison of Johnson& Johnson Philippines. In collaboration with the Department of Health, Healthy Pilipinas, we are delighted to bring you this health literacy event entitled Inflammatory Back Pain. Ating suriin, ating alamin. As a support to the celebration of the 2021 National Disability Prevention and Rehabilitation Week with the theme Kalusugan at Kaunlaran ng Pilipinong May Kapansanan, Isulong sa Gitna ng Pandemya. We hope that this event will increase your awareness and provide more information about inflammatory back pain, to encourage suspect patients to seek proper medical consultation and inform healthcare professionals on its clinical cues for proper management. For some guidelines, may we ask everyone in the Zoom meeting to rename yourself by indicating your agency or organization and name. Keep your microphones on mute until you are engaged. You may use the raise hand function of Zoom to be acknowledged. You may reserve your questions until the Q&A portion. Use the raise hand button and wait to be acknowledged. Alternately, you may also put your questions in the chat box and address them to specific speakers. We encourage you to turn off your video during discussions to save your internet's bandwidth and to prevent distraction. Lastly, we'd like you to stay present throughout the session. To give us the welcome remarks and to grace our event, we are honored to hear from Dr. Beverly Lorraine C. Ho. Dr. Beverly Lorraine Ho is the Concurrent Director for Health Promotion Bureau and Disease Prevention and Control Bureau at the Department of Health Philippines. Immediately prior, she was Chief of Research Division of the Health Policy Development and Planning Bureau, where she worked to provide the evidence needed to support health system reform by designing innovative research grants and building institutional capacity for policy research. These efforts have significantly contributed to the passage of key legislation on sugar-sweetened beverage tax, tobacco tax and universal health care, and the institutionalization of the health technology assessment process. She has also worked in the Philippine Health Insurance Corporation and has provided technical assistance to the government of the Philippines and Southeast Asia on health financing, maternal and child health, and health impact assessment. She co-founded Alliance for Improving Health Outcomes, a nonprofit working to raise the profile of public health and develop a critical mass of public health professionals. Dr. Beverly Ho is a fellow of the Maurice Greenberg World Fellows Program at Yale University, the Equity Initiative, and the Atlantic Institute. She holds an MD from the University of the Philippines and an MPH in Health Policy and Management from the Harvard T.H. Chan School of Public Health as a Fulbright Scholar. Without any further ado, let's hear from Dr. Beverly Lorraine C. Ho.
Good afternoon, everyone. Along with our partners at the Philippine Rheumatology Association, Axial Spondyloarthritis Association, and Johnson& Johnson Philippines, we enjoin all of you to listen in and learn more about inflammatory back pain. Through initiatives like this, we aim to increase awareness and educate more Filipinos, both patients and healthcare providers, on how to better detect and manage ankylosing spondylitis early and appropriately. So today, you'll hear about current efforts of the DOH, what you need to know about inflammatory back pain from one of my dearest teachers and one of the best rheumatologists in the country, and how it is to live with ankylosing spondylitis viewed from a patient's lens. This activity is part of our overall goal of improving health literacy in the country, quality of care, and appreciation for primary care. So we would very much welcome your feedback on how we can do this better in the coming weeks and months. Paalala po namin, kung may nararamdaman po kayo, kumonsult tayo agad sa inyong primary care provider or GP nang tuluyan ng mapawi ang inyong kaba. Tulong-tulong tayo lahat para sa Healthy Pilipinas.
Thank you
Good
very
afternoon.
much for the warm and kind words, Dr. Beverly Ho. Indeed, we are one with you as we create our country, a healthy Pilipinas. Now, to talk about what inflammatory back pain is and its overview, may I introduce our speaker, Dr. Bernadette Hazel M. Reyes. Dr. Bernadette Hazel Reyes is a professor in the Division of Rheumatology, Department of Medicine at the UP College of Medicine. She is currently the Assistant Associate Dean for Academic Development and heads the Medical Education Unit of the UP College of Medicine. In addition, she is a past president of the Philippine Rheumatology Association. She currently heads the Special Interest Group for Spondyloarthropathy in PRA. Without any further ado, let us now learn from Dr. Bernadette Hazel Reyes. Dr. Reyes, the screen is yours.
Good afternoon, everyone. Let me just set this up. Am I on slideshow view already?
Dr. Hazel, you're on presenter view.
Okay, let me just swap. Yeah. I think mas gusto ko yung sinabi ni Bev na intro sa akin kanina, dearest teacher daw. It's always a pleasure to be mentioned as a teacher of such an accomplished doctor as Dr. Ho. So good afternoon, everybody, and how do you say it? Happy National Disability Prevention Week. But I hope at some point it will become No More Disability Week, no? So this is an effort for us to introduce to you one of the common conditions that we actually encounter in primary care, which is back pain, but trying to share with you the whole concept from the perspective of a rheumatologist. Are my slides all right? I
Dr. Hazel, it's not on full view, Doktora. Parang nakat lang po siya in between. At
sorry
this
about this. I think ano to, perils of
we can
live show.
try stop sharing again, Doc, and then ayan.
So, I'll just, you know, we tried this so many times kanina, it worked, no? Syempre now it doesn't work. Let me just end sorry everyone.
No problem, Doktora.
Parang we tried it 5 times and it worked 5 times. Okay. Screen share. Let me just do this. Share. Okay, is it working now? Not yet.
Not yet, Doktora.
What about this?
There you go, yes. Perfect na, Doktora.
Perfect na. Okay, I don't know what happened. We did exactly the same thing. But again, good afternoon. So our topic this afternoon is inflammatory back pain, no? So I have a very simple outline for this afternoon's talk. The first is how do we differentiate the causes of back pain? And then we have to talk about why inflammatory back pain is of special concern, no? We always hear this, that 90% of chronic back pain is mechanical. So if you're looking at this picture as 10 or 20 individuals, it's only the one in red who's probably not mechanical back pain. So in a lot of instances, people forget about it or don't pay attention to it because usually it goes away. But what about this person in red? No, what about the rest? So when we're talking about back pain, there are certain things that a patient with back pain, especially if it's a chronic back pain, uh, who comes to the clinic needs to be asked. No? So these are the questions we need to ask, and these are what we call red flags in terms of history. So fever is one, weight loss. So kahit sasabihin niya, Dok, masakit yung likod ko. Pag masakit ang likod for more than a month, you have to ask these things. Tumatagal ba to ng mahigit na 4 hanggang 6 na linggo? Nag-worsen ba yung pain? I mean, is it getting worse over time? Because usually mechanical back pain gets better over time, no? Nakakaabala ba ito ng tulog ng pasyente? Is there significant morning stiffness? O mas masakit ba siya paggising sa umaga? Nagkakaroon ba ng neurologic deficit? So this is weakness, different sensations, or nag-iiba yung pakiramdam, no? Lalo na kung sa paa. Also, things we need to ask if a patient comes with back pain would be a history of trauma, no? Nabundol, nahulog, nadapa, no? Napaupo. Use of medications such as steroids or immunosuppressive, or a past history or current history of cancer and osteoporosis. These are the things that need to be asked of all patients who come to the clinic with back pain. Sometimes when we examine patients, more often than not, wala tayong nakikita. But for those of our listeners who are doing occupational medicine, there are certain things you have to look at if the patient is coming in with vaguely characterized back pain, no? Yung tinatawag na yellow flags. So, inappropriate tenderness is one. Yung konting pisil mo lang, parang nagkakandapilipit na yung pasyente sa sakit. Pain on simulated axial loading. If say, oh, I'm gonna press on your head, gano ba to? Ang sakit-sakit, doktora, no? Distraction signs, so you'll look for consistency of the findings if you're talking to the patient, or if the patient is not really paying attention. Baka pag tinanong mo siya, masakit ba to? Sasabihin niya, ang sakit-sakit. But actually, when you're pressing the same area while talking to the patient or not asking about the presence or absence of pain, the reaction may not be the same. No? So these are yellow flags that we need to check, because if 3 out of these 5 actually are positive, no, on our physical examination, then they can be indicative of psychological distress. No? Baka may ibang pinagdadaanan yung pasyente. Now, in terms of the red flags, it's really important to pay attention to this, because they can individually or as a group, they can give you clues as to non-mechanical causes of back pain. For instance, if the patient has fever or constitutional symptoms and nocturnal pain, and then has use of steroids, other immunosuppressives, or illicit drugs, then infection should be part of your consideration. Or if a patient has history of cancer and maybe losing weight again, no, unexplained weight loss, then you have to think, is there metastasis going on in the spine? Now, earlier I made mention of neurologic problems. So these are bowel and bladder problems. And often the patients are not going to volunteer the symptoms to us, because they go to you, their issue is back pain. They're not going to tell you that they've been unusually constipated, diba? Unless you ask. So sensory deficits, saddle anesthesia, or motor deficits, weakness perhaps in one leg or the other, should clue us in that there might be a neurologic problem going on. But as far as our topic is concerned today, which is inflammatory back pain, the usual things that patients would tell you if you ask, but only if you ask, is that the pain is usually worse in the morning. There's morning stiffness of more than 30 minutes. It's not improved with rest. And in fact, they feel better after moving around a bit. And in some instances, it may be associated with arthritis, maybe in another joint in the body, such as the knee, the ankle, or the fingers, right? So in these instances, this is a very simple table that would help you differentiate, no? So inflammatory back pain, as we said, has persistent morning stiffness, improves with exercise, and it also happens in patients who are younger, no? So at mechanical back pain, usually at any age nangyayari, pero inflammatory back pain usually afflicts the younger population. And the onset of symptoms in mechanical back pain might be variable, meaning inuulan, like now it's raining hard, people are worried about flood, they start lifting things, bringing them to the second floor, and that night they start having back pain. But for patients with inflammatory back pain, it's very insidious, dahan-dahan dumarating. And usually tumatagal talaga siya for more than 3 months. One of the key features that we need to ask patient is that sumasakit ba sa may bandang puwet, no? Especially if it's alternating buttock pain, that should tell you that something is going on. The other thing is if when they tell you that there's pain at night, you ask what time of the night? Paghiga ba? After midnight? So a lot of our patients wake up in the second half of the night, meaning after a period of rest, and that's when the back pain starts. Okay? So these are key things to remember. And it's good to think about this because inflammatory back pain represents 5 to 6% of all patients with chronic back pain. But more importantly, especially for the purpose of this talk, it's because inflammatory back pain is the cardinal manifestation of what we call axial spondyloarthropathies or your axial spondyloarthritis. Now, some of the healthcare practitioners in the room might be thinking, what the heck is axial spondyloarthritis? Parang hindi yan tinuro sa medical school, no? So, axial spondyloarthritis is actually a spectrum. On one hand, there is the familiar ankylosing spondylitis with a classic radiologic finding of bamboo spine, parang ito, no? Para siyang bamboo. And on the other spectrum is what we call non-radiographic axial spondyloarthropathy or spondyloarthritis, wherein there are no X-ray changes yet, but sometimes we can already see signs of sacroiliac inflammation in the MRI. Now, this is important because a proportion of patients with non-radiographic axSpA actually can progress to AS in about 1.5 decades. And we all know that AS usually is really a slow disease. No? Kanina sabi ni Bev, dapat alamin ang symptoms ng ankylosing spondylitis. So, ngayon, alam ko na kung anong year siya nag-graduate because the language really has changed over the past couple of years, no? So right now, the classic description again is ankylosing spondylitis, but we're now using the term axial spondyloarthritis to include patients who may not have the X-ray changes yet, but are going to go there unless we do something about it. Now, as Bev mentioned, axial SPA must be identified early. No? The sad thing is that because most of us, including me, grew up during the time that what we mostly talked about is AS, and it was mostly known to be a disease of females, we actually don't pay attention so much to back pain among the women. And if you notice here, for non-radiographic axial SPA or the other end of the spectrum, there's equal number of men and women. So for AS itself, the delay in diagnosis is about 7 years. So for women, mas marami sa kanila yung actually hindi natin na-diagnose in a timely manner because for us healthcare professionals, our consciousness is still AS is still a disease of males. So maybe that's lesson number 1. Nangyayari din talaga siya sa women and we have to be cognizant of early symptoms among patients with chronic back pain. Now, it's also because the manifestation would be classic for the men, siguro because it was characterized earlier, which is the classic inflammatory back pain, buttock pain, and then the sacroiliitis. But for women, sometimes the symptoms are a bit more vague. Widespread pain, heel pain, pelvic pain, and enthesopathy. And for the clinicians in the room, I know that you have a lot of patients who tell you, I have pain all over because I do the housework. Ako lahat gumagawa sa bahay. Or masakit yung sakong ko. I think it's because of the shoes I wear. No? Or I have pain in my pelvis. And maybe because it's my menses, no? It becomes an OB issue. And sometimes it's easier for us to say baka nga, no? Rather than thinking of it as a paradigm shift in terms of thinking of it as symptoms of inflammatory back pain. Now, as I said earlier, the term AS is the established term, but we're now using or transitioning to the term axial spondyloarthritis. In truth, this is not new. This is about 2009, the ASA's clinical criteria for spondyloarthritis was already written upon. But I think it only got into widespread use over the past 5 years. So the ASA's criteria for spondyloarthritis applies to any patient with more than 3 months of inflammatory back pain, as we described the first part of the talk, with onset of less than 45 years of age. So it's the younger patient with more than 3 months of back pain, especially if it's inflammatory in character. And there are two ways actually of branching out in terms of the ASAS criteria. The first is a documentation of sacroiliitis on imaging, or the other one is the blood test, which is your HLA B27. Then you probably you're gonna tell me, what? Lahat ba ng patients ko na may back pain, kailangan ko ng ipa-HLA-B27? The answer is really no. What we need to pay attention to is the chronicity of pain, the age of onset, the characteristic of the back pain, and the presence of other spondyloarthritis features as described here. Wait, I'll use my pointer. Here, as described here. And we'll go through them later one by one. Now, let's go first about imaging. No? What exactly are we talking about when we talk about sacroiliitis on imaging? So this is X-ray of the pelvis, wanting for us to see the sacroiliac joint. And this is normal sacroiliac joints. You actually see the space here between your articular surfaces, but you'd see your SI joint is there clearly demarcated. And then later on, as it develops, you already start to see irregularities in the borders of the sacroiliac joint, although you can still discern the space between the joint. But as the disease progresses, you would see that the space becomes narrower and narrower up to stage 4, wherein your sacroiliac joint or it's already completely obliterated, and makikita nyo, magkadikit na yung sacrum and iliac, no? Kaya nga sacroiliac. So, nagiging line na lang siya. When we see changes such as in B, C, or D, these are actually late. So, sometimes the X-ray is normal, but if you do an MRI, you already see changes such as bone marrow edema. Kaya pumasok po yung konsepto ng non-radiographic axial SPA. Natutunan po kasi namin yon in terms of the RA, in the concept of RA. It used to be for rheumatoid arthritis, inaantay mong magkaroon ng damage sa joints before you're able to diagnose it as RA. Pero nakita na with early diagnosis and earlier treatment, pwede palang hindi magka-deformities ang RA. So this mindset is now being applied to a lot of inflammatory joint conditions. Now, I said we'd go through the other symptoms one by one. No? So, other symptoms that we need to look for that should clue you in that you need further testing will be the presence of peripheral arthritis. So, masakit yung kanyang likod, tapos maga yung kanyang tuhod, or may namamagang joints sa fingers or in the ankle, or the presence of enthesitis. So this is a picture of a man with enthesitis. You see here that very swollen yung insertion ng kanyang Achilles tendon to the calcaneus. So if you remember, the enthesis is the insertion of your tendon to the bone. In here, very, very clearly, you could see the swelling. So heel enthesitis is one SPA feature. The other one is, actually, no, pag naisip ko lang, if the patient tells you, kasi nagpalit ako ng shoes, baka ang daling isipin na, ano lang yan, tendonitis na regular or calcaneal spur. But in the context of back pain, this is not something we ignore. We have to look at it as a SPA feature. The other thing we need to look for is what we call uveitis. For my age group, nung tinuturuan tayo ng arthritis, ang sinasabi, ask for red eyes, right? And usually red eyes is associated with one type of SPA. But now we know that across the different types of spondyloarthritis, maraming nagkakaroon ng uveitis. So more often than not, it's a mild redness. Baka pagkakamalan lang yan na conjunctivitis or sore eyes, no? Doon pala uveitis na yung nangyayari. Other symptoms that we need to look for would be dactylitis here, or dactylitis is also known as sausage-shaped digit, no? So you would see hyperpigmentation, nagda-darken yung skin, and it's not just the joints that are swollen, but the whole digit is actually swollen. So for my patients, I tell them, mukha bang longganisa, no? Kasi hindi naman red ang hotdog sa atin, no? At hindi tayo use sa sausage na brown. So mukha bang longganisa yung toes mo? And usually, pag sinasabi lang, oo, doktora, masakit siya at namamaga, then you know that that's dactylitis. This can be very painful upon palpation. And this is what dactylitis looks like after it subsides. Of course, one of the cardinal features is also psoriasis. So if the patient complains of back pain, please don't forget to ask about skin lesions, no? And inspect behind the ears, on the hairlines, or areas where you expect psoriasis lesions to be seen. Because in a lot of instances, the back pain is part of the psoriatic arthritis syndrome. Now, the other things that was in the ASES criteria includes Crohn's disease, inflammatory bowel diseases. Those are less common here in the Philippines, so I'm not going to highlight them in this talk. So these are screening questions we can ask when a patient comes to us with chronic back pain, and we need to screen them out for inflammatory back pain. Actually, it's very simple. 5 questions. Did your symptoms start before the age of 40? Did your symptoms develop suddenly? Do your symptoms improve with exercise? Do your symptoms improve with rest? Or do you experience pain at night that improves on getting up? If they say yes to 1, 3, and 5, then you can be very sure that what you're dealing with is inflammatory back pain. So usually it's a yes to 1, 3, and 5, and a no to 2 and 4. So what do you do then? No? So again, a patient comes in with chronic back pain. So in chronic back pain itself, there's only 5% probability that it's HL spa. But you do your screening questions, and then it looks like it's inflammatory back pain. Your probability for HL spa actually increases. In these instances, you can go straight to asking for an HLA-B27 or refer the patient to a rheumatologist if you're not too sure. So inflammatory back pain plus clinical spa features, as were emphasized earlier, enthesitis, family history of ankylosing spondylitis, uveitis, alternating back pain, peripheral arthritis, dactylitis, psoriasis, Crohn's disease, or a positive response to NSAID should clue you into spa features. So it's either you can do the HLA-B27 at this time, or advise the patient to have a radiograph or an MRI, or you refer already to the rheumatologist and make it the rheumatologist's concern to actually diagnose this patient. Now, why is it important to do this? Na ano ba yun? Inflammatory back pain lang, napunta kami sa HLA-B27 or biglang meron ng very aggressive imaging investigation. No? It's because we don't want to see this anymore. No? This is the physical impact of HL spa in patient's life. So this is a classic picture that I'm showing you, documenting 4 decades of ankylosing spondylitis in a patient. No? So these are archival pictures. So 1947, this is our patient. Probably did not have symptoms yet, or maybe just mild symptoms. Baka at this time, HL spa pa lang siya. But you see, after 10 years, kumukuba na siya, kakaroon na siya ng thoracic kyphosis. After 20 years, they already have the question mark or supplicant posture. And then you would see already after 5 years from this, how pronounced the changes are in terms of the physical condition of the patient. Why? Because you start out from thoracic kyphosis, but you also have other issues that are going on. Osteoporosis, so you have to think of it as the disease is, the deformity is getting accelerated. And then when the patient comes into this condition already, the lung gets restricted because practically your chest space becomes smaller and they start having restrictive lung disease, or sometimes they already have cardiovascular disease. I'll be showing you a couple more pictures of patients um, with established AS. And these are the things we don't want to see na. Kaya nga kailangan maaga pa diagnose na. So this is delayed chin on chest deformity of a patient after getting a lower cervical fracture. Got a cervical fracture here, and now the patient cannot look up anymore. We also see this even without the context of fracture among our patients. Na gumaganon yung ulo nila, they cannot look up anymore. So it becomes very hard to walk. So imagine paano ka tatawid, maglalakad kung fix na yung head mo na nakatungo. So this is this is very, very difficult. Tapos, if you think about it, if you have a patient with this type of deformity who falls into trauma, and we have no way of knowing na may AS pala yung patient, tapos biglang nilagyan ng neck brace, catastrophic results will happen. This is round back deformity of the thoracolumbar spine, already seen in AS. So you would see here the round back deformity in a female patient as that. And this is probably a more dramatic picture of what happens. This is not an old person. This is a young man with AS. Could see that there's problem in terms of the spine, not just in terms of forward flexion, but also sideways. So it's a very, very dramatic turn of the spine, and the patient is almost doubled over. It almost looks like Pott's disease, diba? That we class untreated POTS that we see, that we used to see. So this is the patient after extensive correction. Ang dami-daming repairs na ginawa. But you see, it's not, the issue is not yet done because now they have to correct naman the cervical spine. And here, the compensatory flexion of the knee still needs to be corrected. So this is this patient will need multi-stage procedures, and it becomes very difficult. So our goal is never to see our patients falling into these types of deformities anymore. Now, I talked about physical disability among patients with SPA, but there are non-visible comorbidities in axial SPA as well. So, anxiety, changes in mood, changes in personality and self-perception, feeling of stigmatization, that they get singled out, and social withdrawal becomes issues for our patients. This is an entire lecture in itself, but let me just share this with you. And this study was made among patients suspected to have inflammatory back pain. So these aren't even the established diagnosis patients yet. And how does that impact into their lives? So the disease burden of axial SPA is actually similar to what is seen in rheumatoid arthritis. No? So the yellow ones are RA, the blue ones are SPA. So for RA, full-time employment actually gets diminished over time to as little as 25%. For SPA, only half of them are able to work as much as they would like because of their condition. And you would see here that in terms of global assessment of the doctor, of the patient, in terms of pains in the joint, in the spine, pain at night, morning stiffness, and fatigue, it's very, very similar to data of patients with rheumatoid arthritis. So, ito, inflammatory back pain pa lang, ganito na talaga siya kaproblemado. So, one thing is to diagnose the patients early, and maybe while you're waiting for the proper test to be done or the proper consult to be done or really to getting a diagnosis, we can already help the patients in some way. I'm not going to elaborate on this because our next speaker has a very interesting perspective in terms of this condition, and I will let her talk about this at length later. But briefly, we want to be able to enjoin our patients to have the ideal posture both when standing and when sleeping, have a regimen of exercise, which of course the pandemic has made difficult for a lot of them. Also to stop smoking, because smoking has been shown to worsen the prognosis of these conditions and contribute to the worsening of restrictive lung disease after decades of illness. NSAIDs are our favorite go-to drug for pain. But for spa, we only give them 3 months. If they don't work, then we have to move forward. No? So yung usual go-to drugs natin will be NSAIDs for our synthetic DMARDs. Sadly, for axial spondyloarthritis, your synthetic DMARDs such as methotrexate don't work as well as your biologic DMARD. So internationally, this is the new standard of care in terms of axial spondyloarthritis. And I'm glad we're doing it in the DOH forum because we've really been wanting to advocate for the use of for the inclusion of biologic DMARDs in our Philippine National Drug Formulary para ma-avail naman siya ng ating mga patients sa mga public hospitals. Because it's been shown that they do improve clinical, radiologic, and patient-reported outcomes, and they increase the likelihood of remission. And I can cite to you literature upon literature showing that these are actually the standard of care internationally, including in our region. And this is a 2018 guidelines made for the Asia-Pacific region. And part of the authorship is myself and Dr. Leonila Dan. So dalawa kaming Pilipino dito. At yun din yung sinasabi ng ating regional guidelines. So in essence, what I'm trying to share with you is the thought that although majority of back pain is due to mechanical causes, it's important for us to identify other causes. And we have to keep in mind that inflammatory back pain can be part of the 10%. And these are important to identify because they may indicate the presence of axial spondyloarthritis. And we know that axial spondyloarthritis needs to be adequately treated so the patients don't go into the disability or the deformities that I shared with you earlier. So key things to remember is early identification of patients and their problems. We really need the help of government for this in terms of providing more robust pharmacopoeia for our patients. We have now clearer therapeutic targets for our patients, and taken together, we hope that they would lead to better patient outcomes. Sabi nga, healthy Pilipinas, no? So healthy Pilipinas, dapat healthier patients para magkaroon tayo ng healthier Pilipinas. And I'd like to leave this with you. If you suspect inflammatory back pain or axial SPA, if you need to rule out axial spondyloarthritis, or if you are sure that this is in fact axial spondyloarthritis, we really encourage you to please refer them to your rheumatologist. So maraming salamat sa inyong pakikinig.
Thank you so much for the very informative and comprehensive discussion, Dr. Reyes. I learned that not all back pains are the same. It is indeed important to know and differentiate the cause of it, lalo na kung matagal na yung nararamdaman natin and may iba ka pang nararamdaman sa ibang parte ng katawan katulad ng heels, eyes, toes, and skin. Hindi siya pwedeng baliwalain lang dahil ito ay pwedeng lumala. At may iba pang parte ng katawan, even emotion and mood natin na pwede pang maapektuhan. It is also important to know that inflammatory back pain is of special concern given that if it is not managed properly, it can lead to deformities. Nakita nga natin kanina yung mga larawan na pinakita ni Dr. Reyes, talagang kubado na sila no, because of possible delayed in diagnosis. So kailangan talaga tingnan ng sakit na ito holistically. The good news is that we have specialists like rheumatologists, that patients can consult to and for healthcare practitioners to partner with for proper diagnosis and treatment of this condition. Kaya importante for us to really seek the right medical consultation to learn more about what the patients are feeling and what they are going through. This is also to help them achieve a good quality of life. And ang ganda din ng sinabi ni Dr. Hazel that as one country, we should work together to bring access of these medicines to the patients. Healthier patients lead to healthy Pilipinas. So to our dear participants, should you have any questions, you may submit it in the chat box or reserve it later for our open forum. So moving on, now, to share with us the journey of a patient living with ankylosing spondylitis, let me introduce our next speaker, Dr. Maria Cristina Cariza B. Calibag. Dr. Cariza Calibag is currently practicing as a rehabilitation medicine specialist at the DOH Hospital in Palawan. She is also an active member and a representative of the Eggshell Spondyloarthritis Association of the Philippines. Dr. Kalibag is here to talk about real experiences of patients battling eggshell spondyloarthritis. So without any further ado, let us now listen to the story of Dr. Carissa Kalibag. Dr. Kalibag, the screen is yours.
Thank you for that introduction, Ma'am Lara. Magandang hapon po sa lahat. Let me just share my screen po. Okay. Okay. So again, magandang hapon po sa lahat ng mga nanonood at sumusubaybay sa ating programa ngayong hapon. So ngayong linggo po ay pinagdiriwang natin ang 43rd National Disability Prevention and Rehabilitation Week. At ako po pala si Dr. Cariza, isa po akong rehab doctor at higit sa lahat, isa rin po akong pasyente na may ankylosing spondylitis or eggshell spondyloarthritis. So tulad ng sinabi ni Dr. Reyes, ang ES po ay hindi na lang para sa mga males or mga kalalakihan. I'm a living proof na ang AS po or ankylosing spondylitis ay pwede rin ma-diagnose sa isang babae. It has been 10 years simula nung it has been 3 years simula nung ako ay na-diagnose. Pero medyo huli na nung ako ay nag-diagnose. It took me 10 years na may chronic back pain at hindi ko alam kung ano yung nangyayari sa akin. At nung finally na-diagnose ako, meron ng mga permanenteng pagbabago sa aking katawan. So today also, ibabahagi ko sa inyo ngayong hapon ang aking personal na journey bilang isang pasyente na may ankylosing spondylitis at bilang isang rehab doctor para ma-prevent natin ang posibleng disability that comes along with eggshell spondyloarthritis. So tulad nga ng sinabi sa lecture ni Dr. Reyes kanina, ang eggshell spondyloarthritis ay isang rheumatologic condition kung saan merong inflammation sa ating spine. Itong inflammation na to, hindi lang actually sa likod natin nangyayari. Pwede rin itong atakihin ang iba't ibang parte ng ating katawan. Tulad nga sa sinabi ni Dr. Reyes, pwedeng maapektuhan ang mata. Actually, pwede rin bituka, yung tinatawag na inflammatory bowel syndrome. Meron ding pwede rin maapektuhan ang ating iba't ibang joints tulad ng shoulder, hips, tuhod at ankles. Actually, kadalasan ang mas pinaka-affected o yung tinatawag na peripheral arthritis, ang pinaka-affected ay ang hip joints. Ito yung mas grabing naapektuhan sa mga taong may eggshell spondyloarthritis na yung iba ay kinakailangan ng operahan. Kumbaga, humahantong sila sa punto kung saan kailangan na sila operahan dahil sa sobrang destruction na nangyayari sa kanilang hip joints. At dahil nga po na multisystemic ang mga signs and symptoms na nararamdaman ng isang pasyenteng may axial spondyloarthritis, naapektuhan na rin nito ang iba't ibang aspeto ng buhay ng isang pasyenteng may axial SPA. So nariyan ang pain. So sa isang pasyente na diagnosed with axial SPA or AS, ultimo pag-ubo or pag-sneeze or pagbahing ay nagkukos ito ng sobrang sakit sa likod. Kumbaga yung likod mo pwede hatching ka lang, mag-sneeze ka lang na isang beses, talagang nagsisend siya ng spasm sa buong likod mo. Tapos parang pinipilipit yung likod mo. So 24/7 din ang pain na nararamdaman ng isang pasyenteng may axial SPA. So itong pain na to, nagkukos siya talaga ng, kumbaga, debilitative talaga ang pain. Nagkukos siya ng limitation ng range of motion or yung tamang range ng ating mga joints. Ang ankylosing spondylitis rin ay meron ding kaakibat ito na other medical comorbidities. So yung iba mas prone na magkaroon ng diabetes, nagkakaroon din sila ng problema sa puso. So yung mga cardiopulmonary problems, medyo common din sa mga patients with ankylosing spondylitis. I think na-mention kanina ni Dr. Reyes yung tinatawag na restrictive lung disease. Actually, bilang isang rehab doctor din, isa yun sa mga hirap ako na gawin dahil ang isang ES patient talaga ay mas mabilis mapagod. Yung lungs kasi yung katawan ng patient na may AS, dahil sa paninigas na nangyayari, ang lungs nila, syempre na may rib cage na tinatawag, no? Mas hirap mag-expand yung rib cage na yun na nakakaapekto sa paghinga ng isang pasyente na may AS. So, bukod doon, ang mga taong may axial SPA ay naapektuhan rin ang mobility ng isang pasyente. So, nandyan yung mas hirap silang kumilos. Like kanina na-mention din yung morning stiffness. Sa umaga talaga, doon yung yung parang mas hirap kang kumilos sa umaga, and then eventually as the day progresses and mas kumikilos ka, nag-i-improve yung motion mo. Also, minsan yung mga ibang mga pasyente, yung mga talagang advanced na, ultimo pagkilos sa kama or yung bed mobility nila, talagang hirap na hirap sila. Parang di segunda ang kanilang pagkilos kapag yung sa mga pasyente na may advanced na axial SPA na nararamdaman. Also, affected din ang activities of daily living ng isang pasyente na may axial SPA. So, dito sa activities of daily living, ano ba itong mga to? So, ito yung pagkain, pagbibihis, grooming, toileting. Ma-share ko lang sa inyo, yung unang-unang pasyente ko bilang isang rehab resident ay isang AS patient. So isa siyang ankylosing spondylitis patient na lalaki na for the longest time talaga, siguro mga 3 years siyang kama lang ang kaya niyang gawin, pag-ikot lang sa kama, nakahiga lang sa kama, hindi din siya masyado nakakaupo dahil sa kirot, sa pain na nararamdaman niya. And because of that, nung na-receive namin siya sa rehab namin, sa rehab ward, at nung nire-rehab namin, na kita rin namin kung paano naapektuhan nito yung activities of daily living niya. Ultimo, itong pasyente na to, kung maghuhugas siya, kunyari dumumi siya at kailangan niya maghugas ng buttocks niya, hirap na siya. Actually, hindi niya kayang gawin yun. Kailangan niya ng caregiver or alalay kapag kailangan niya maghugas ng kanyang buttocks. So, imagine mo, paano ba maghugas ng buttocks? Magte-turn ka, naka-extend ang iyong shoulder, magro-rotate yung spine mo para mahugasan mo yung iyong buttocks. So, sa ibang mga pasyente na advanced na rin talaga ang axial spondyloarthritis nila, very talagang hirap na silang gawin yon. Parang isang malaking task na yung simpleng paghuhugas ng kanilang buttocks kapag sila ay dumudumi. So yung iba rin po, hirap na magbihis dahil naapektuhan na ang kanilang shoulder. So paano ba magbihis? 'Di ba? Tataas mo yung kamay mo, isusuot magsusuot ka ng damit. So yung iba, dahil sa limitation of range of motion ng kanilang shoulder at dahil na rin sa pain, hindi nila maangat yung shoulder nila. So imaginein mo paano ka maliligo para mag-shampoo, paano ka magsusuklay, 'di ba? Kailangan naiaangat mo yung yung kamay mo, yung braso mo, 'di ba? Paano rin ikaw magsusuot kung sa mga females, paano sila magbabra kung talagang limited na ang range of motion ng kanilang shoulder. So ito ay mga areas na talagang affected rin talaga ng axial spondyloarthritis, no? So bukod doon, apektado rin ang trabaho or occupation ng mga pasyente who are diagnosed with axial SPA. So ma-share ko lang din ulit, no? So since being a member po of the Axial Spondyloarthritis Association of the Philippines, meron kaming support group, meron kaming chat, meron kaming Facebook page, and then in that chat or messenger po, nandun yung may mga kwento, iba't ibang kwento ng mga pasyente na may axial spondyloarthritis. Siguro nakakuha ng aking attention ay isang police. Isa po siyang police na nakadestino sa Bulacan. And from time to time, nagme-message talaga sa akin na sumasakit yung hips niya, sumasakit yung likod niya, ano yung mga exercises na pwede niyang gawin. Imagine nyo na isa kang police, nandun yung pain, nandun yung limitation of range of motion, paano mo magagampanan ng maayos yung trabaho syempre, di ba, it involves a lot of physical activities kapag ikaw ay isang police. Isa ring kwento na nandun ay isang teacher. So kung ikaw ay teacher at itong teacher na to ay diagnosed with axial spondyloarthritis din, 'di ba? Paano kung ngayon medyo online tayo, pero syempre before kadalasan mga nakatayo ang ating guro habang sila ay nagtuturo. So, syempre yung mga ganong factors nakakaapekto rin 'yon. Personally bilang isang doktor, syempre nandun yung nakakapagod din siya kasi naramdaman ko rin yung effect niya sa aking trabaho, sa aking occupation kasi nandiyan yung mas mabilis talaga ako mapagod. Nandiyan, hindi ko, kumbaga, kunyari mag-rounds ako sa mga pasyente at yun, mag-rounds ako sa mga pasyente. Talagang kapag magsi-stairs kami, kasama yung mga consultant ko, talagang nandun yung hingal na hingal ako. Tapos at the end of the day, mabilis na ako mapagod. Hindi na ako minsan nakakapag-exercise at the end of the day kasi nga pagod na. So may ganong factors din po na involve sa mga pasyenteng may axial spondyloarthritis. No? So next din po ay environment. Ang mga very important din po that we take into consideration the environment of the patient. Safe ba to? Kaya pa ba niyang yung mga kunyari yung mga may advanced AS, yung kamusta yung beds nila, may railings ba, kaya ba nilang tumayo kaya ba nilang umupo or tumayo ng mag-isa na safe para sa kanila. So we have to make sure that the environment we provide for patients with axial spondyloarthritis is safe. So isa ring malaking factor na kailangan nating we have to look into consideration is the personal factors. So ito yung mga psychosocial factors. Ang pasyente na diagnose ng ankylosing spondylitis, kadalasan po they really undergo an episode of depression. Syempre, ikaw ba naman normal ang iyong pagkilos, bigla-bigla kang magiging dysfunctional kasi sobrang in pain ka or hindi mo na magagawa yung ibang mga bagay na dati mong ginagawa, you'll really feel some form of depression. So, kailangan ma-address rin po natin to kasi kung they will remain in that state of depression, paano sila magiging paano nila gugustuhin na gumaling, 'di ba? So kailangan ma-address din po 'yon. Isa rin sa mga factors na nagko-cause ng depression in patients, nagkakaroon kasi talaga sila ng body image changes. So as you can see nga in my slide, nandiyan yung postural na pagbabago sa isang pasyente may ES patient. So nawawala yung yung normal na kurba ng ating spine, ng ating lumbar spine, ng thoracic thoracic spine natin at nagmumukha silang mas kumukuba, kumbaga, ang kanilang itsura. So syempre, kung ikaw ay bata or you're in the young age range at nandyan yung pagbabago sa body image mo, talagang it can cause depression. So kailangan magkaroon ng counseling para sa mga pasyente na may axial spondyloarthritis. So, bukod doon, actually, yung ibang mga pasyente na very, very advanced na talaga yung sakit nila, 'di ba? Syempre dependent na 'yan sa mga kamag-anak or other caregivers. Syempre kung pangmatagalan tong sakit na 'to, nagkakaroon ng caregiver fatigue. So syempre napapagod din yung mga nag-aalaga. So yun yung mga kailangan din natin i-address in seeing a axial spondyloarthritis patients. So in the rehab standpoint, ano nga ba or paano namin ina-approach ang isang pasyente na may ankylosing spondylitis? So axial spondyloarthritis. Unang-una, very important ang patient education. I cannot emphasize this enough. I think it's very important that we educate our patient. It's not just about them. It's not just about empowering the patient, but when you educate someone, you also empower the loved ones. You empower the family members. You empower the caregivers that surround the patient. So very, very important po talaga itong patient education. Later on, iisa-isahin ko actually sila kung paano ba inaatake or ano ang pwede natin gawin sa bawat approach na to sa isang pasyente. So, syempre, dahil nga meron na tayong limitation of range of motion sa mga patients with axial SPA, kailangan magkaroon ng improvement or at least ma-maintain natin yung functional mobility na meron pa ang isang pasyente. Bukod doon, kailangan may appropriate physical modalities or exercise na ginagawa ang isang pasyente at pwede rin natin sila ma-assess kung kakailanganin na ba nila ng orthosis or any assistive device para sila ay maging independent on their own. So when it comes to patient education, like I said, very important po. Kaya we're very thankful na merong programa ang DOH programa ang DOH na tulad nito dahil talagang we really have to educate not only the patients, the caregivers, but as well as the healthcare practitioners. So like mentioned earlier, kailangan nandyan yung tamang gamot. Pero paano ba kailangan nandyan yung tamang diagnosis para maging tama rin ang paggamot sa kanya. So, like I said, like mentioned earlier, nandyan po yung mga gamot natin na NSAIDs para ma-address yung pain and inflammation at nandyan yung mga biologics natin. Personally, very life-changing po simula nung nag-take ako ng biologics. Every month, nag-inject ako ng biologic and it has helped me in improving the quality of life that I'm living right now. Pero sadly, hindi lahat po kasi nakaka-afford nung biologics natin dahil meron talaga silang kamahalan. So minsan doon sa mga messages sa chat box, talagang makikita mo, laban lang tayo, ipagdasal lang natin yung kirot, sana maalis. Pero on the point of view ng bilang isang doktor, minsan nakaka-frustrate at nakakalungkot na dadaanin na lang sa dasal dahil hindi nila ma-afford yung tamang gamot na dapat ma-receive nila. So gobyerno para ma-afford, mas maraming maka-afford ng tamang gamutan para sa axial spondyloarthritis. So bukod doon, patient education, stress management. Ang stress naman po talaga ay part ng buhay natin pero to some patients po talaga, yung stress ay trigger ng flares, na yung tinatawag na flares, or mas nag-worsen yung kanilang pain when they are under stress. Part siya talaga ng buhay, pero ang mahalaga ay matutunan mo kung paano siya ma-manage. Kapag na-manage mo yon, syempre, 'di ba, parang better, magiging mas okay ang iyong pag-handle doon sa stress, and magle-lessen yung iyong episodes of flares and inflammation. So also, nandyan yung proper diet. So kailangan, may mga studies po talaga na nagsasabi ang alcohol, yung mga processed food, talaga nagkukos po siya ng further inflammation or triggers or flares sa mga pasyente na may axial spondyloarthritis. So talagang yung mga ganong pagkain talaga kailangan silang iwasan ng mga pasyente. And there are some studies naman na nagsasabi na yung turmeric nakaka-lessen ng inflammation, pero syempre bago kayo kumbaga self-medicate ng mga ganun, kumonsulta muna kayo sa inyong mga doktor kung safe ba na gawin or gamitin yung mga ganong bagay. So syempre more of fruits talaga, fiber, vegetables po, and syempre mga nuts, makakatulong din po siya in lessening the inflammation that we have. So diet is very important. Also, syempre, you don't want to gain weight kasi syempre, mas mabigat ka, mas sasaluhin ng mga joints mo yan, ng likod mo, ng hips mo, ng tuhod mo, ankles mo. So talagang you have to maintain your healthy weight, no? You have to maintain your healthy weight kasi talaga nakaka-apekto rin siya sa paglala ng pain doon sa mga joints natin. So susunod po, nandyan po ang mga support groups natin. We have to educate our patient na nandyan, merong tayong mga support groups. Siyempre, iba yung alam mo na hindi ka nag-iisa sa pinagdadaanan mo, no? So I think personally, I think I'm very thankful na nung panahon na na-diagnose ako ng AS, I was in the middle of my medical residency, and I couldn't be any more thankful to my juniors, to my batchmates, dahil sila yung tumulong sa akin psychologically. Tapos yung tipong pag-i-inject ng biologics, hirap na hirap ako kasi hindi ko kaya, na may fear din ako nun. So alam mo yun, sila yung nag-i-inject. Tapos sa mga nanonood din naman sa atin na syempre mga nanonood sa atin na may ankylosing spondylitis, I just want to let them know na meron tayong support group na available for patients with axial spondyloarthritis. Nakakatuwa actually itong support group na to, nung syempre tayo ay nasa middle of the pandemic. Nandiyan yung mga tanong about vaccination. So makita mo talaga sa chat box, nag-uusap sila, pare, nagpa-vaccine ka na ba? Anong mga naging side effects mo? Safe ba sa atin na may mga axial spondylitis, na pwede bang safe ba na na magpa-vaccine? So nandun yung mga reply, makikita mo talaga. Tapos yung iba pa, may isa ako nakita, tinulungan niya talaga na pare, dito ka magpa register, baka mas makakuha ka kaagad ng vaccine dito sa lugar na to. So nandun talaga yung effort and support ng isa't isa, na alam mo yung hindi ka talaga nag-iisa sa battle na ito. So next, isa sa mga patient education na gusto nating iparating, na ang proper positioning can affect your posture. So tulad ng nakikita nyo sa screen na to, it is recommended to do prone lying, or yung pagdapa ng about 10 to 15 minutes a day. So, yung nakikita niyong babae sa likod, actually it's a good it's a good form of positioning, yung medyo parang iaangat mo yung likod. Pero kung saan lang kaya, some patients kasi talaga hindi na kayang iangat yung likod nila, or yung mag-back extension na tinatawag. So, hindi kailangan pilitin. Pero yung proper positioning po, I cannot stress this enough, very important po talaga. Tulad ng nakita nyo rin sa screen, na yung pasyente na nakahiga, no? may pillow sa sa ilalim ng kanyang tuhod or sa kanyang legs. Minsan masarap siya talaga pag may pillow kasi nakaka-relieve ng back pain. Pero sana hindi natin siya i-maintain or dalasan ng paglalagay ng pillow. Minsan kasi since nagkakos nga siya ng relief sa likod, nasasanay sila na may pillow sa ilalim ng tuhod or sa may hips. So ang nangyayari, yung tuhod nila nakabend at dahil matagal sila nakahiga, hindi na sila masyadong kumikilos, nagkakaroon ng contractures. So yung joints nila hindi na masyadong ma-move and dahil doon, paano kung eventually maitayo na natin yung pasyente pero may contracture na siya ng tuhod and hips. So syempre mas lalong mas mahihirapan tayo siyang itayo kasi off balance siya, mawawala yung balance niya kasi deformed na ang kanyang tuhod and ang kanyang hips. Also, ina-advise din po namin na huwag mag-side lying kapag natutulog. Dahil syempre, paano ba matulog ng side lying, 'di ba? Medyo parang fetal position 'yan Talaga nakabend yung hips and tuhod mo rin. So sana mas iwasan yung pagtulog ng naka side lying. Also, kapag naka sideline ka, 'di ba, nadadaganan yung shoulder mo. So minsan nagkakaroon sila ng all the more nagkakaroon or lumalala yung kanilang shoulder pain. So sana maiwasan ito and pwede naman siguro from time to time kung talagang in pain, pwedeng siguro lagyan ng pillow pero wag papatagalin na naka-maintain yung unan sa ilalim ng tuhod or sa may hips. So next sa sa rehab approach natin sa mga pasyente with axial spondyloarthritis, nandiyan yung improvement or maintaining the functional mobility of the person. So may tinatawag ba yan? Nawala. Ayan. So sa rehab po, meron tayong tinatawag na joint protection techniques or principles. So ano bang ginagawa dito sa joint preservation techniques or principles? So minsan ang sometimes pain is good kasi isa siyang signal or warning na yung ginagawa natin ay hindi na okay or hindi na tama sa ating katawan. So when we feel pain, dapat i-stop natin kung ano yung ginagawa natin, yung activity na ginagawa natin. Bukod doon, nandyan yung tamang pag-ehersisyo or strengthening and maintaining the range of motion. So nandyan yung stretching ng ating leeg, leeg, shoulders, hips and also the knees. So yung sa stretching naman, hindi kailangan din biglain or pilitin na talagang mag-stretching kayo, no? So kung hanggang saan kaya na, kunyari advanced na yung inyong axial spa, kung hanggang saan kaya, doon pwedeng gawin or hanggang doon lang yung pwedeng gawin natin during stretching, no? Also, sa joint preservation techniques natin, nandyan po yung tamang proper body positioning din. Kapag kunyari, nagbibitbit tayo ng bag. So for males, di ba, yung mga backpack, minsan one shoulder lang. So talaga yung posture mo, nakaganon ka. Kasi bit-bit mo on one shoulder lang yung bag mo. So parang for ladies, ganun din. Di ba? Madalas we use mga shoulder bags. So it's just on one shoulder and then naka-bend or lateral deviate yung katawan ng isang pasyente. So talagang minsan masasanay talaga yung posture mo na nakaganon ka. So may mga techniques kung paano siya gawin. Kung talagang backpack yung kailangan mong gamitin, use the two what do you call that, straps to put on your bag. And then kung mahilig ka mag-handbag, baka ngayon medyo uso yung fanny pack, yung parang body bag na kinakabit lang sa waist. So baka kung konti lang naman yung gamit mo, you can use that para hindi kailangan maling position ang iyong katawan, no? So isa rin na advice namin for the joint preservation is the equal amount of rest and activity. Sa mga pasyente po kasi with axial spondyloarthritis, talagang nandun yung from the time ay may isang minuto masakit talaga, so hindi ka makakakilos, pero all the more kasi na hindi ka kumilos, mas lalong maninigas ang iyong katawan. So nandun yung balance or balance talaga dapat na saktong paggalaw at pag-rest kapag ikaw ay in pain at ikaw ay may diagnosed as axial spondyloarthritis. So ito ay personal sharing lang. Ito ako po 'yan. So thank you to the biologics nga, like I said, very life-changing siya kasi nag-improve yung quality of life ko. Ever since talaga active ako, I play sports, and then nung naging sobrang malala yung mga flares ko, hindi din talaga masyado nakakakilos. Ultimo, I had to miss work sometimes kasi nagba-back pain talaga at hindi ako makalakad na maayos. So after taking biologics, ayan, mas nakakapag-laro na ako ng tennis. So nakakapag-hiking ako ulit. So nag-improve talaga yung well-being ko as a whole. So yung psychosocial factor din, pati yung paggalaw ng mga katawan ko and joints ko, nag-improve talaga. So, ayan. So, sabi nga, in axial spondyloarthritis, bukod po sa mga DMARDs or mga biologics natin and NSAIDs, may iba tayong mga physical modalities na pwedeng magawa during therapy. Nandyan po yung hot and cold therapy, nandyan yung ating mga diathermy or electric therapy, or sometimes yung low laser therapy po na usually ginagawa sa therapy or rehabilitation po. So bukod doon sa mga physical modalities na ngayon, very important po talaga ang ehersisyo or exercise sa mga pasyente with axial spondyloarthritis, no? Not only kasi na mag-improve yung mobility ng tao, pero through exercise kasi nag-i-improve din na yung cardiopulmonary function ng isang pasyente. So like I mentioned kanina, mas madali talaga sila mapagod. So by doing or engaging yourself in the proper and correct exercise that is fitted for you, mas mag-i-improve talaga yung iyong cardiopulmonary function. Also, nandyan yung psychological well-being kapag ikaw ay naglalaro ng sports. Actually, isa sa mga paborito ko ang dancing. Hindi ako magaling hindi ako magaling, pero favorite ko ang as a form of exercise ang dancing kasi not only exercise you, di ba parang nagsa-stretching ka dyan nang hindi mo na-realize na sa stretch mo na pala yung mga joints mo, nagiging mas flexible, mas nagiging flexible ka. Also, mas nag-improve yung cognitive function mo kasi nandiyan yung kailangan mo mag-learn ng steps, kailangan mo matandaan yung mga steps and to actually remember them. So nandiyan yung cognitive function. Also, yung cardiopulmonary, syempre nakakapagod talaga siya, nakaka-increase ng heart rate. Tapos nandiyan yung nagsa-stretching and syempre yung mga ibang positions. So nandiyan na yung strengthening ng ibang mga muscles natin. And syempre, when you do dance, nandyan talaga yung better psychological function and syempre socialization. Pero syempre right now since pandemic, yung socialization part medyo questionable pa or hindi pa natin magagawa. Pero kumbaga there are other exercises that we can do na low impact sa ating mga joints. So yung iba doon yung yoga na tinatawag, and then meron din mga aquatic therapy, although hindi masyadong common kasi yung mga swimming pool or public swimming pools dito sa Pilipinas, pero it's very effective and talagang kumbaga piniprescribe siya kasi syempre kapag ikaw ay nasa water, you're more buoyant. So mas magaan ka. So nandun yung ini-eliminate mo yung effect ng gravity sa joints, sa likod, sa tuhod, sa balikat, pati sa mga hips and knees mo. So Other exercises also are, for example, other exercises na pwede mong gawin ay biking, no? So, make sure lang din, pero make sure lang kung sa biking, minsan, di ba, you can adjust the resistance. So, wag din bibiglain yung resistance when it comes to biking kasi pwede rin mag-cause naman ng pain sa tuhod, di ba? So, kailangan, when you do exercise, make sure then you warm up your body. Yung paglalakad lang ng siguro 10 to 15 minutes, it's a good warm up na wag yung bigla nasasabak ikaw sa isang strenuous activity or exercise. So finally, bilang isang rehab, ina-assess din namin, ito bang pasyente na to, kailangan na ba ng orthosis or nung assistive device? May mga advanced patients po talaga ng axial spondyloarthritis na hindi na masyado nakakakilos. At syempre, kung hindi sila masyado nakakakilos, nandun yung palagi silang ina-assist ng kanilang family or caregiver. Pero ayaw natin yun eh. Mas gusto natin yung independent yung pasyente. Yung nakakaya niya or nagagawa niya yung mga bagay-bagay on his own. So, pero paano kung advanced na talaga? So, nandyan yung mga assistive device na pwede natin ibigay. So, yung mga reachers, mga sock aid, pwede ka suot ng socks or ng medyas on your own. Tapos, yung paano yung mga may limitation ng range of motion ng balikat. So, nandyan yung mga special device natin na lalagyan mo ng, para siyang, yan, tulad ng sa picture, parang tube na pwede malagyan ng suklay para mas ma-reach nila yung buhok nila. Tapos, sometimes, some patients talaga nagko-complain sila ng pain, yung foot pain. So, nandyan yung pwede tayo magbigay ng mga shoe modifications sa mga pasyente natin with axial spondyloarthritis para ma-lessen yung pain sa kanilang paa. Sometimes din nagko-complain sila ng pain sa tuhod. So nandiyan yung bracing na pwede rin natin ibigay para mas magawa nila yung mga activities na gusto nila while being pain-free. No? So, thank you everyone. Thank you po sa pakikinig sa Axial Spondyloarthritis Association of the Philippines, sa mga members namin na nakikinig ngayon. So, hello sa inyo. And sabi nga natin na we got your back. And let's turn disability into abilities. So visit us on Facebook, on our Facebook page. If you know someone who you think is suffering or is diagnosed with axial spondyloarthritis, hindi ka nag-iisa. Nandito kami. Just message us and we'll be happily to include you in our family. So thank you everyone. Magandang hapon po.
Thank you so much, Dr. Kalibag, for sharing the 4 rehab approach in axial spondyloarthritis. Thank you also for sharing your personal journey. It's really an eye opener, Dr. No, as it gives us a different perspective when we hear it directly from patients suffering from this condition. So you've really shown us that a patient's activities of daily living are really affected. That's why I'm very glad, Doctora, to hear your testimony and to see you enjoying your life right now, despite what you've been through. And it is because of the help of proper diagnosis and treatment.
Yes.
So that's why conversations like these po are very important for us to know more about what's really happening in our body. And I would just like to echo what Dr. Kalibag mentioned, that another good news is that people suffering from axial spondyloarthritis and also their caregivers are not alone. And their patient support group is very active. You can check their Facebook page for more information and for you to connect with them so that you have someone to talk to about what you're going through. So thank you again for all the sharing, Doctora. So right now, we are in the part of our event where our speakers can address your questions. We are opening the floor or screen for the panel discussion. And to moderate our session this afternoon, I'm pleased to introduce to you the head of Johnson & Johnson Philippines Medical Affairs, Dr. Erwin G. Benedicto. May I again invite our resource speakers, Dr. Reyes and Dr. Kalibag, to be with Dr. Benedicto. So we'll
Thank
just
you.
short open forum po. Thank you, doctors.
Thank you, Lara. And I wish to thank 2 passionate speakers we have one a doctor and another a patient, but still being a doctor. We have a lot of questions that we receive in the chat box. First to Dr. Reyes, also my mentor, ma'am. What would be a good recommendation or exercise for office and work from home setting to prevent low back pain? Or Dr. Carissa can also chime in if needed.
I think Carissa is better equipped to answer that question than me. But I think one thing that we are should be cognizant about is that nobody is designed to sit for 12 hours a day in front of a computer monitor. And sadly, that's where most of us are. Carissa, I'll defer to you on that.
Okay. Oh, thank you, Ma'am Hazel, Dr. Hazel. So to answer that question, actually, tama si Dr. Hazel, no? Dapat talaga hindi tayo matagal masyado na nakaupo. So we just have to make sure na from time to time we do stretching or we stand up from our computer. So actually, kung ikaw ay isang nagtatrabaho and yung work mo talaga ay sa harap ng computer, no? We have ergonomic na mga tables where you can raise it para mapipilitan ka rin tumayo. Also, when it comes to chairs, meron tayo talagang yung siguro make sure na yung chair mo ay firm ang upuan, hindi masyadong malambot, hindi masyadong matigas. Minsan kasi may misconception, matigas, lagi ako ng unan. Pero minsan mas lalo nagkukos siya ng back pain kasi lumulubog yung spine mo, so or yung puwetan mo. So yung spine mo, pumapangit yung alignment and mas lalo ka nagkakaroon ng back pain. So kailangan proper ergonomic positioning lang din ng iyong katawan, and yun nga, may mga kumbaga equipments na tayo na pang office na mas makaka-address ng ating proper posture sa kapag tayo ay nagtatrabaho sa offices.
I think this is yours too, Ma'am Carissa. What would be the best biomechanics in doing clerical works?
Clerical works, you mean po like typing? Siguro mga
Typing, siguro, yeah.
and
Administrative staff work, yeah.
oh, actually yung sa mga clerical works minsan ang maganda sa kanila, 'di ba? Sila din yung mga nag-aayos kasi ng mga papeles. So required sila maglakad. So actually yung maganda yon na yung kumbaga napipilitan sila pumunta from one place to another kasi na-force sila tumayo or hindi ma-maintain yung isang position lang. So for clerical siguro kung yun talaga yun din yung kumbaga yung ang trabaho mo ay parang palaging nasa harap ng computer, nagta-type, nakaupo, yun lang, make sure lang siguro for every hour, siguro you can set a time on your phone every hour or every 2 hours. Make sure you stand up from your computer. Tapos make sure lang yung alignment ng iyong tawag dito, keyboard ay hindi masyadong malayo or hindi masyadong malapit from you. Kasi minsan talagang nandyan pumapasok minsan kapag pangit talaga yung tawag dito, yung posisyon ng iyong mga gamit sa opisina. Nandiyan pumapasok yung carpal tunnel kasi pangit yung position ng wrist mo. Tapos yun nga, nagba-back pain ka. So talagang kailangan you just have to make sure na tawag dito, yung proper din na upuan ang iyong ginagamit, hindi din siya masyadong kurbado or yung minsan naka-incline kasi, 'di ba? Minsan na-change natin yung inclination nun. So make sure you have the 90 yung tinatawag na 90 degrees ng posture. So kung ito yung likod mo, ito yung legs mo, yung hips mo. So nakaganyan ka, hindi ka naka-stoop down kasi sasakit yung likod mo. Huwag din naman masyadong naka-incline kasi nakagano naman yung neck mo. So pwede mag-neck pain ka rin. So yun po.
Okay. To Ma'am Hazel, yeah, go ahead, Ma'am.
Doc Erwin, add ko lang. Parang ako yung pinakamatanda dito, no, ma'am talaga.
No.
Tama yung sinabi ni Carissa. In fact, several years ago, we used to celebrate yung Bone and Joint Disease Awareness Month, di ba? Week yun, naging month. Actually, decade, oo. Pero tas naaalala ko, may ginawa actually flyer or instructions yung rehab medicine group, no? Ano ba yung tamang pag-upo? So generally, dapat yung computer screen mo diretso sa mata mo. So hindi ka nakaganon, hindi ka rin nakaganon, no? Tapos, dapat talaga yung naka 90 degrees, no? Yung upo mo, dapat daw lapat yung paa sa floor. Lapat yung paa sa floor. Tapos, yung tuhod mo, tsaka yung hip mo, magka-level. Di ba, Carissa, tama? Hindi yung nakaangat yung puwet mo or nakababa yung puwet mo. So, tama yung 90 degrees. But, just adapting it to the work from home, kasi issue natin ngayon yan, lalo na for our patients with AS, maybe this is the time if you have extra money to really invest in uh, additional
Mga
tools.
tools.
Oo, to make your setup better. Sana mapa-share ko sa inyo, no? Nakabili ako ng mura na patungan ng computer so hindi ako nakaganon sa laptop. Tapos bumili ako ng extra keyboard na ina-attach ko sa laptop ko so hindi nakadiretso yung arms ko pag nag-work. Yung sometimes little things like that make a whole lot of difference. Sana
Difference.
mahanap natin yon, Carissa, no? Yung handout na yun ng farm. That
Yes,
was nandoon pa ba yon?
I think ma'am, we still have it in the department. So I think
Oo.
nakikinig ngayon yung department ng rehab medicine sa PGH.
Oo.
So siguro we can distribute that, and of course syempre another mga infographics ba na
Yes.
makakatulong sa ating mga pasyente. So yes ma'am, we can
Tapos, di ba
actually
may 3
post that.
o'clock habit kayo dati?
Yes
Na
ma'am, yung
at
tatayo ka
3
talaga.
p.m., tatayo ka talaga, mag-exercise ka talaga. I think kailangan nating ulit-ulitin yun ngayon. Healthy Pilipinas yung pinag-uusapan natin. Dati relevant lang siya sa mga nag-office work. Pero ngayon, mga estudyante, baka dapat meron na rin silang 10 a.m. and 3 p.m. habit.
Yeah, in J&J nga, sometimes in J&J, one of our practices when we are having office, at 3 o'clock patay ang computer, may lalabas na form of exercise that you need to follow. But
Wow!
anyhow, that's one of the things that we have done before. Going back to low back pain, ma'am, I know na how important it is for every Filipino who might be complaining of low back pain to seek consult at wag lang baliwalain. How important it is because it is the campaign that we wish to advocate to everyone.
Yeah. How important it is. Again, I'll go back to the first part of my lecture, no. Most cases of low back pain is mechanical. It should get better in about a month. If your back pain persists for more than a month or it's been there for more than 3 months, please do ask for help. I know that sometimes maraming pasyente yung ibang doctors, kung minsan hindi nag-go through yung maraming screening questions. Pero sana mapalawak natin yung
Yeah.
screening questionnaire for inflammatory back pain. Kasi if you have a patient with who actually says yes to all of those, ang laki na nung capture mo na patient population na baka pala hindi na-diagnose. Carissa's here. I see June Umali also with ASAP. I know that they suffered a lot before they actually got diagnosed. I'm wondering, Carissa, on your end, if
It
these
takes 10
questions were
years.
asked for you early, but if these questions were asked of you early, or if you were aware of these questions much earlier, you think it would have made a difference?
Yes, actually, ma'am, to add on your comment to your answer po, no. Before kasi parang alam mo yun, pag na-diagnose ka kasi or kapag nagkaroon ka kasi ng back pain, it can be the source can be from anywhere. So talagang hindi mo minsan akalain na ay seryoso na pala yung back pain na nararamdaman ko. So like you mentioned nga po, Dr. Hazel, na kapag pakiramdam nyo matagal na yung inyong back pain, siguro kailangan na kayong i-re-evaluate. Baka may mas problematic na pala or mas malalang problema na nangyayari sa inyo na kailangan ng masolusyonan ng maaga. On my part po, being a patient, siguro nandun kasi yung factor na nung nag-start ako mag-back pain, I play sports kasi, so I play soccer. May time na nadulas ako, tapos tumama talaga yung pet ko. After 2 weeks, doon nag-start ako mag-pain. Tapos, since nandun yung history ng trauma or
Yes.
fall, ever since parang siguro nakatatlong doctors ako na pinuntahan in that 10 years na nagba-back pain ako. Iba-iba yung mga nagiging diagnosis ko. Nandun yung muscle strain, lumbar strain, nandun yung herniated nucleus pulposus or slip disc. Tapos nandun din, yun. So yun yung mga naging diagnosis ko na because of that one instance or one particular incident na nadulas ako, parang doon na na-pinpoint na, baka related to trauma. Pero it's been 10 years kasi, talagang ang tagal
Yeah.
na. So
Yeah.
parang you'll be wondering bakit ganito katagal na nagpipain pa rin ako at 10 years na nag-NSAIDs pa rin ako na hindi siya natatanggal. Tapos siguro yung paglala lang talaga niya na ultimo pag sneeze or pag-ubo, talaga nagsasend siya ng wave of pain sa likod na hindi ka nakakahinga. Mapapaganon ka. So siguro yung ganun talagang very, to me, I think it was the alarming part already na sabi ko, teka nga, makapag-x-ray nga ako. So nung nagpa-x-ray ako ng sarili ko, pagkita ko, bamboo spine, ay, ayan na. So yun, kumonsulta na po ako. Doon po naging, medyo naging, doon ako kumonsulta sa isang rheumatologist. Pero yun, siguro, mali din on my part kasi feeling ko alam ko yung ginagawa ko bilang isang doktor din pero hindi pala. Mali din pala ako. So yun, medyo late na nga lang nung nalaman ko pero nonetheless sobrang thankful ako na okay pa rin ako ngayon.
Yeah.
If you were diagnosed earlier without those bamboo spines, can she be able to have earlier treatment without having biologics?
Okay. That's a loaded question, no? Kasi 10 years ago, hindi pa naman talaga standard of care yung biologics. Ano? Tapos, siguro ang mabibigay din kay Carissa, kay Doc Carissa at that time would have been NSAIDs and maybe your biologic DMARDs. But, we learn from experience, or we should learn from our experience. And experience already tells us that the outcomes are not ideal kung NSAID lang or non-biologic DMARDs lang. The usual methotrexate, hydroxychloroquine, sulfasalazine ang nabibigay. So now that we know better, sa akin talaga, we have to start early. Bakit mo aantayin magdikit-dikit yung buto? Bakit aantayin mo mag-bamboo spine kung pwede palang hindi? 'Di ba? Siguro nakatulong kay Doc Carissa na she was very active. No? So kahit papaano, unwittingly, there was a rehab component to her back pain. So she remained functional. But that's not the story for every patient. And to me, masakit talaga kasi sometimes we see patients, they're 24 years old. Magko-complain sa'yo na ang sakit ng balakang. Tapos pagkita mo sa x-ray, sira na yung hips. Tapos pag tinanong mo, may persistent history pala ng back pain. And then nakakalungkot because like Dr. Carissa, they actually consult, they ask for help. But since the consciousness is low, that there is such a thing as eggshells pa, then hindi na diagnose. Kasi nga, most of us, like including me, tayo Erwin, diba? Ang alam natin, ankylosing spondylitis, bamboo spine. So pag wala kang nakitang bamboo spine, it's not. Ngayon alam natin, hindi natin dapat inaantay yon. Dapat hindi sila umabot doon.
There's a question from the chat box, ma'am. If there is a localized pain on one side of the low back area, will it still be considered as low back pain or muscle strain?
That's hard to differentiate.
Yeah, correct.
That, no? Because sometimes the pain in AS would be buttock pain. And in some instances, it's alternating buttock pain. So I don't know if that's what they mean, unilateral. So still, I think the safe thing to do is go through your checklist.
Yeah.
Is it persistent? How old is the patient? Is it improved with rest or not with inactivity? So I think the screening questions are very, very important to still ask.
Yeah, they have to consult the doctor rather than assume that it's nothing else.
And
Yes.
for our doctor colleagues, just still do the due diligence.
Yeah.
Madali lang naman pong tanongin yung 5 na questions na yun.
Yeah, we can ask DOH to post that 5 questions for that everyone will know. The other questions, I'll take the 2 last questions in the chat box. are chiropractic practices an effective therapy? I know there are a lot of chiropractic practices that are being posted in Facebook, or rehabilitative action toward early or advanced spa.
Mm.
Actually,
Or
okay.
any
So
one of you believe on that?
ah, okay, so let me answer po this question, no. Actually, ang dami rin nagtatanong sa akin. Nagba-back pain sila, pero may AS sila or eggshells pa sila, so they want to go to a chiropractor. I think my answer to that is wag na lang. Kasi yung mga AS patients or yung may may eggshell spondyloarthritis, nangyayari dyan, nagiging brittle din yung mga buto nila. So, maaga sila nagkaka-osteoporosis, mas nagiging brittle yung buto nila. And ano kasi ang chiropractor ay form of spine manipulation. So baka sa pag-manipulate ng spine nila, lalong magkaroon ng fracture or ang worst, baka maipitan
Mm-mm.
sila ng ugat na mag-cause ng spinal cord injury. So dapat talaga hindi masyado or wag silang magpa-chiropractor kasi nga pwedeng magkosto ng injury. Also yung question na early ba dapat or late na. Syempre mas okay kung as early as being diagnosed with ankylosing or eggshell spa ay mag-start na sila ng rehabilitation kasi ang gusto natin ay hindi sila humantong sa pagkakaroon ng disability or yung deformity ng kanilang katawan. Also, gusto natin ma-maintain talaga yung cardiopulmonary function nila kasi isa yun sa mga mahirap na naapektuhan talaga ng eggshell spa na kailangan talaga ma-address. So, I think it's always prevention. Totoo yun, prevention is better than,
Proud of cure.
follow up. Diba? Intayin mo pa ba na yung hips mo ay ma-destroy? Tapos kakailanganin mo ng opera, syempre mas mahal yun as opposed to exercising properly. Pero like I said po yung exercise, may kanya-kanya tayong dapat na exercise or kailangan siya specifically patterned to a person kasi hindi lahat ng may axial spondyloarthritis ay pare-pareho ng kumbaga itsura na. So,
Yeah.
kailangan specified or kumbaga yung tamang ehersisyo sa tamang kalagayan nung pasyente na merong ES or
Ah,
eggshells pa.
dagdag ko lang yon, Doc Erwin, kasi when you say, will it be better, no? Depende kung ano yung tinitingnan mo, no? Even if we're talking about physiotherapy or chiropractic therapy, what is the outcome that you're looking for, no?
Mm-mm.
There is some evidence that properly done physiotherapy, no? Properly done, as Dr. Risa said, it's actually individualized. There's no one way of doing it for all patients, is helpful in terms of symptoms. It is helpful in terms of avoiding some of the deformities. But in terms of addressing the root cause of the problem, which is inflammation, kailangan talaga ng gamot. Kaya nga, kami sa PRA, nagka-campaign kami na sana mas maging accessible yung mga gamot para sa mga pasyente.
Okay. Last question. Are there risk factors for an individual to have spa so that at
Yes.
early stage they can prevent it?
Okay. Ano yung mga known risk factors? No, genetics is one. Kaya nga isang spa feature is having a family history. Pero hindi naman ibig sabihin na lahat ng mga pasyenteng merong may lahi ng ankylosing spondylitis o psoriasis or inflammatory bowel disease ay mauuwi sa eggshell spa, no? Pero for patients na may ganung family history, kailangan siguro mas maging observant sila sa kanilang mga symptoms and be a bit more cautious about asking for help. Ngayon, if you have the gene, sabi natin, hindi naman lahat magkakaroon ng sakit, no? Pero may mga things na sa mga rheumatic conditions na alam natin na nakaka-trigger o nakaka-awaken ng bad genes, no?
Mm-mm.
Infections is one. Sa rheumatoid, very well established ang role ng smoking, no? If you have
Okay.
bad genes and you're a smoker, you're more likely to awaken your bad genes. So, if you have a family history, please do not smoke. eat healthy. No? Kasi may pinag-aaralan ngayon na yung relationship ng mga bacteria sa bituka at sa causation ng mga ganitong karamdaman. Pero ito lang, baka lang kung ano-ano yung kainin o inumin na diet. Wala pa talagang maayos na data na pag naging ganito yung diet mo, hindi ka magkakaroon ng karamdaman o gagaling ka or ito'y makakasama sa iyong karamdaman.
Okay, thank you, Dr. Reyes and Dr. Kalibag. I know we have overtime already for almost more than 12 minutes. I wish to give the floor again to Lara and thank you for the two advocates. This is just our first step towards making everyone know how important low back pain, especially the inflammatory ones. So back to you, Lara.
Thank you so much, Dr. Irwin, for moderating the open forum. And thank you again to our speakers, Dr. Hazel Reyes and Dr. Carissa Calibag. It was indeed a fruitful and very informative discussion. And sadly po, no, medyo nagkulang lang tayo talaga ng time to address all the questions. But thank you to all those who submitted their questions. And thank you again to our speakers for addressing these questions of our participants. So we're down to the last part of our event, and to award our resource speakers in sharing their expertise and experiences with us this afternoon, may I present this certificate of appreciation on behalf of the Department of Health and Johnson & Johnson Philippines. So this certificate of appreciation is awarded to Dr. Bernadette Hazel M. Reyes in grateful recognition and deep appreciation for her invaluable service as research speaker during the health literacy event entitled Inflammatory Back Pain, Ating Suriin, Ating Alamin, conducted on July 22, 2021. Given this 22nd day of July 2021 in Metro Manila, Philippines. Signed by Dr. Beverly Lorraine C. Ho and Dr. Erwin G. Benedicto. For the next certificate, so this certificate of appreciation is awarded to Dr. Maria Cristina Cariza B. Calibag in grateful recognition and deep appreciation for her invaluable service as resource speaker during the health literacy event entitled Inflammatory Back Pain, Ating Suriin, Ating Alamin, conducted on July 22, 2021. Given this 22nd day of July 21 in Metro Manila, Philippines. Signed by Dr. Beverly Lorraine C. Ho and Dr. Erwin G. Benedicto. So to formally close our session, may I again give the screen to the head of Johnson & Johnson Philippines Medical Affairs, Dr. Erwin G. Benedicto.
Thank you, Lara, again. I wish to thank, first of all, Department of Health, Dr. Beverly Ho, the Health Promotion Bureau, the Communication Management Unit, and the Disease Prevention and Control Bureau of the Department of Health. Thank you for collaborating with us. It's really a milestone for us as we move forward inflammatory back pain as one of the advocacies that we bring to the public. We wish also to thank our advocates, our speakers, our passionate people who are working for AS, both the doctor and the patient, Dr. Ma'am Hazel Reyes and Dr. Maria Cristina Cariza, who is at the same time a rehab doctor. We wish that this session that we have will be our first step towards everyone's awareness of what is AS, how important inflammatory back pain in terms of early diagnosis, prevention of disability, and for those patients who needs biologics or treatment during this time, they can be equitably accessible or they can equitably access the medication. In one way or the other, our our journey is towards making the Philippines a healthier one with everyone enjoying what they can have, being accessible to all kinds of medication, especially those patients with AS. So with that, I'll say that I'll end a quote from Helen Keller, a disability right advocate. Alone we cannot do so little. Together we can do so much. With that, thank you Department of Health, Dr. Hazel and Dr. Kalibak and the rest who stayed with us during this our raining afternoon. I hope everyone is safe and dry. God bless us all.
Thank you so much for gracing us this afternoon, Dr. Irwin, and again to our partners from the Department of Health for collaborating with us in this special event. So to commemorate our event, may I invite everyone to turn on your camera for a group photo taking. So our partner from DOH Communications Management Unit, Ms. Krisha Misa, will take the screenshot. So to our attendees here, if you're comfortable, you can open your camera for the photo taking.
So let's open our cameras. I'll be taking the photo. Let me just gather you. Okay. So taking the photo in 3, 2, 1. Okay, thank you everyone.
Thank you, Ms. Krisha.
Salamat.
Salamat. So before we officially end, may we also ask everyone for your gift of feedback. So we will be showing a screen and we will be sharing a link in the chat box. Or you can type in your browsers bit.ly/feedback, that's capital F, underscore back pain, capital B and capital P, for us to know how we can improve our sessions moving forward. So certificates will be given to those who will provide their feedback and accomplish the form. So again po to everyone, maraming salamat po. Thank you for spending your Thursday afternoon with us. Thank you for making this event a success. We hope that you found this session meaningful and informative. We wish you safe, dry, and well during these times. God bless us all and have a great day ahead. Maraming salamat po.
Thank you.
Thank you, doctors. Dr. Cariza,
Thank
Dr.
you.
Higzel.